Hi everyone, Patrick Menninga here, spiritualriver.com. I want to talk to you today about detox and how that relates to drug addiction and alcoholism. Now, if somebody's struggling with addiction and they want to turn their life around and get on a new path in life, you can't just go from 0 to 60 in a heartbeat. You can't just step on the gas and be right where you want to be immediately. It's a transition. And so part of that transition is getting detoxed. So your body is addicted to drugs or alcohol physically, or maybe you're just psychologically dependent on them. In any case, most people who want to transition to a new life in recovery have to go through some sort of detox process. And so if you call up a drug and alcohol treatment center and you go in and you stay for 28 days, typically the first couple of days of that stay, you'll be in a medical area that they refer to as detox. And nurses will watch over you, and you might take some medications or whatever. And that's just so that your body can basically flush out the drugs or the alcohol, whatever it may be that you're addicted to, flush those things out of your system so you can be clean and sober. And so one of the keys with this is don't try to do it alone. People who try to detox themselves generally don't fare too well. This is, of course, more true the more addicted you are. So if you're really struggling with addiction, then that's a clear sign that you probably need to ask for help. And there's no shame in going into treatment. There's no shame in going through a medical detox. Don't beat yourself up over that stigma. Get on the phone, call a treatment center, and get the help that you need. I would urge you to go to a real rehab, a 28-day program, and go through their medical detox and then follow that up with residential treatment. One of the things a lot of people don't realize about the detox process is that they have what's called acute detox, which happens within a matter of days when you're first detoxing your body from the chemicals. But there's also something called PAWS, which is an acronym. It stands for PAWS, just like an animal has paws. And that stands for post-acute withdrawal syndrome. And so this is something that can happen long after the acute withdrawal is over with. So maybe you've detoxed from alcohol or painkillers or some other drugs, and you go through that detox and maybe it lasts like 3 to 5 days. And after that, you're basically fine and you're past the worst of it. You know, you get past the worst part of it. You start to live your life. And at some point down the road, it can be a month later, it can be years later, and you'll experience what they call post-acute withdrawal syndrome. And so all of a sudden, withdrawal symptoms can suddenly pop back up in your life and trigger you to want to relapse. So that's something to be aware of. A lot of people don't know about it. A lot of people aren't aware of that. And so it's something for you to watch out for if you're new to the recovery process. Is this post-acute withdrawal syndrome. You can potentially experience withdrawal symptoms long after your body is through the acute process of withdrawal and detox.